Welcome to my presentation. I am lecturer Marco Florin Mihai and I will present to you today my work Intravenous Low-Level Laser Therapy or Intracellular Therapy. A little bit of history. The method of intravenous laser blood irradiation was first introduced into therapy by the Soviet scientist Meshkalkin in 1981. Originally, this method was developed for the treatment of cardiovascular disease, improvement of rheological properties of the blood, as well as improvement of microcirculation and reduction of the area of infarction had been proved. In the 19th year, the cell biological basis of this was developed by the Estonian cell biologist Tina. Intravenous therapy with low-power laser therapy is a method in which the low-level laser is introduced directly into the bloodstream for generating a photochemical response in the blood cells. First of all, what is laser? Laser is a device that generates light through a process of optical amplification based on the stimulated emissions of electromagnetic radiations. Laser is an acronym for Light Amplification by Stimulated Emission of Radiation. The main features of the laser light are monochromatic, has just one wavelength, that means just one color, collimated, all rays are parallel to each other and do not diverge significantly even over long distances, coherent, all the light waves are in phase both spatially and temporally, brightness, extremely high intensity, high energy, and unidirectional, they have just one direction. Low-level lasers versus hard lasers. Low-level lasers has power less than 500 milliwatts. They are class 3, ER or B, soft and not destructive. No thermic effects occur when they are applied. Hard lasers have power more than 500 milliwatts, class 4, they are rich in energy and the irradiation has direct physical effects like heating and coagulations. They are used as surgical lasers in practical. Some practical uses for intravenous laser blood irradiation. In the first step, a sterile cannula is fixed in a vein, preferably on the patient's forearm, and then the laser catheter is inserted into the cannula. Only disposable accessories are allowed. In the second step, the other catheter end is connected to the patented laser cable adapter. At the catheter end of the cannula, the laser beam exits the optical fiber and delivers laser energy directly into the bloodstream. Direct contact is necessary because a transcutaneous application of laser light into the blood vessels leads to a substantial refraction phenomenon as well as energy dispersion light energy. This would induce an obvious loss of laser energy and thus a substantial decrease in quality of the laser treatment. In addition, an advantage of direct contact laser blood cell is that low-level power are used up to a maximum 5 milliwatts. These values are considered completely harmless in medicine. Then the device is programmed and switched on. At the end of the treatment, the connection between the catheter and the laser module is first interrupted, and then the cannula can be removed together with the catheter. Intravenous low-level laser therapy device allows the laser beam to reach directly into deeper areas of the body. This procedure can be viewed as a photon infusion. 10 sessions in total with a sequence of 3 treatments per week is the recommendation. It is further recommended to start with one wavelength only, usually red, for around 50 minutes with 15% power. If the patient tolerates the treatment, power can be to 100% in the second session. If more lasers are used in therapy, they can as well be added in the second sessions. It is a minimally invasive procedure. The risk of infection is minimal if standard recommendations are followed. Basically, all different wavelengths, actually colors, are used in most conditions to benefit from a maximum of cellular effects. Usually, each laser color is used for 10 to 50 minutes treatment time. That means about 60 minutes in total. Power setting can be programmed individually. Biochemical mechanism of intravenous low-level laser therapy. There are specific cellular structures that are able to absorb specific wavelengths, actually colors, of light, known as photoreceptors. The light stimulus gives a cellular signal affecting the chemical behavior, metabolism, movement, and gene expression. All associated enzymes and/or protein are affected. This cascade even can ripple across the entire cell. Mitochondria are activated at the cellular level. Mitochondria, cellular organelles found in all eukaryotic cell types, are also referred to as the energy factories of the cell because they contain oxidoreducing enzymes necessary for the cellular respirations. Their main task is to produce of adenosine triphosphate (ATP). This process takes place in the inner membrane where the respiratory chain is located. The consequence of the absorbance of different wavelengths of laser light inside cells by photoreceptors is the stimulation of the respiratory chain in mitochondria at a different level. Complex 1 NADH dehydrogenase absorbs blue and ultraviolet light. Complex 3 cytochrome C reductase absorbs green and yellow light. Complex 4 cytochrome C oxidase absorbs red and infrared light. These reactions, depending on the level at which they occur, lead to an increase in adenosine triphosphate, reactive oxygen species, nitric oxide, and intracellular calcium. The production of adenosine triphosphate, reactive oxygen species, and nitric oxide leads to an increase in the concentration of the factors that increase and enhance cellular mobility, stimulating the metabolic process involved in cellular viability. Main effects of different wavelengths on human organism. Red laser, positive influence on rheological properties of the blood, diminishing tendency of aggregation of thrombocytes and improve deformability of erythrocytes, so hypoxia of the tissue is improved and fibrinolysis is activated. Stimulation of immune response with positive effect on the proliferation lymphocytes and B and T cell subpopulation, increase of immunoglobulin IgG, IgM, and IgA, increased production of ATP, and normalization of cell membrane potential. The analgetic, spasmolytic, and sedative are the main clinical effects. Green laser. Green light binds to hemoglobin, so improves the function, behavior, and cell elasticity of red blood cells, and increases oxygen delivery, and decreases in lactic acid. Positive effects on sodium-potassium pump, which helps to regulate intra and extracellular cations homeostasis. Increases significant the production of ATP in the irradiated mitochondria. So, more hemoglobin in the blood with higher oxygen intake. Blue laser. Blue light releases nitric oxide in monocytes with vasodilatation and improvement of endothelial dysfunctions. Nitric oxide is known to be a growth, immune, and neuromodulator as well as stimulator of stem cell proliferation, and it has an important role in analgesia, vasodilatation, and angiogenesis. Is known to act anti-inflammatory and is effective for treating infection. It is nitric oxide that can open up the microcirculation. Yellow laser. Improvement of the antioxidant enzymatic system with detoxifying effects. Improves serotonin and vitamin D production and consecutively strong antidepressive effect and positive influence on the general mood. Sleep better because of the increased amount of melatonin. Ultraviolet laser. Ultraviolet blood irradiation can strengthen the immune system and improve overall health, destroys fungal, viral, and bacterial growth, improves microcirculation by dilating blood vessels, improves the body's ability to detoxify and inactivate or remove toxins. So, the main effects of the intravenous laser therapy are boosting cellular energy by increase of ATP synthesis, immune system stimulation, improvement of microcirculation and reduction of blood viscosity, activates a reparative and stabilizing cellular pathways, reduce inflammations and pain relief, pathogen deactivation, effective against bacteria and viruses, detoxifying effects and positive influence on the general mood. Areas of application. According to the specialist studies, it can be applied to a wide range of pathologies, but as I am at the beginning, without experience in this type of therapy, I will focus on pathologies related to the lack of energy, sleep disorders, and peripheral pain, somatic and neurogenic, exactly. The main contraindication of this kind of therapy, where analgesia might mask progressive pathology, for focusing the laser beam directly into above the human eye, in area injected with steroid, in area of suspicious or potential cancerous tissues, in area with active bleeding or anesthetic areas, in patients with suspected infection diseases, in patients with psychiatric disorders, patients with anticoagulant therapy, patients with implanted stimulation devices, above or near ossification center until the growth period is completed, on ischemic tissue, in individuals with vascular disease where vascularization is not available to cope with the metabolic disease. I think that this is a field with still many unknowns, but which is a challenge for the future. This is the reason why I wanted to present you this work. Thank you.